Welcome to this presentation. Beat stubbornly high blood sugar levels without restrictive low-carb diets and piling even more medications. I'm going to focus on type 2 diabetes, but this will benefit also adults with type 1 diabetes. Now, particularly it will benefit people who would answer yes to these following questions. Are you frustrated by unexpected high sugar levels when you've done everything right? Or at least you think you've done everything right? And are you tired of not being able to eat what you want without consequences, right? That's no fun, having very limited choices of food. And are you tired of feeling good 1 minute and bad the next? Something that I find very often in diabetes. You feel really, really tired, and then later you feel better, but feeling bad again comes back. And so now imagine if you could improve your sugar control considerably and consistently and feel better without hard to follow diets. Is that possible? And without needing to take more medications. Imagine what that would feel like. How will your life change if that was possible for you? So I'd like to explore how this life changed for people who I helped before. And so, yeah, let me tell you why I'm so grateful for doing this work and sharing this information with you. And it comes down to really making a difference in people's lives. Diabetes is a nasty disease that if it's not reined in, ideally reversed, then there could be some dire consequences, and I'll explore that later. Now, these images here are screenshots of video testimonials from people I helped before. And as a doctor, I can't really provide testimonials from clients or patients. So these are students. These were students. Some of you may be familiar, remember my Dr. Klein's Healthy Heart program, and they took that program. So what does that have to do with diabetes? Well, let me focus on Marianne on the right side. When she joined my program, which by the way, content and in the form of documents and videos are available for my clients, my patients. When she joined the program, she stated, if you listen to the video, that she was tired. In fact, if I recall correctly, she was taking care of a family member, and I can't remember if it was a husband or parents, ill parents or an ill husband, but she was very tired. She couldn't sleep. She said she was depressed. She was anxious. And the short of it, she says, after having gone through the program, having received help from me, she says she felt an increase in energy. Her cholesterol, blood levels, blood pressure levels were down. And then she says in a nonchalant kind of way, I'm not diabetic anymore, which is something that I wish on, anyone who's dealing with diabetes and, whose condition is getting worse. It made a big difference in her life. Her mood improved too. And in fact, as you see later on, sugar and mood and cognitive function go hand in hand. So she says she felt happier. So yeah, hopefully this inspires you to the possibilities. So in this class, you will learn the role of carbs or lack of in type 2 diabetes, the causes of diabetes, tips to improve your sugar levels as we go along. I'll provide some tips, and by no means am I treating anyone here. I want to make that clear. And a bit about the shortcomings of medications. So cover that. Now, I'll cover as much as I can within the time limits of this class, and I will show you how to take this further later on, if you'd like to. So sugar is not the cause of diabetes. High blood sugar is the effect of diabetes. This is a very important statement, a very important concept. It's very foundational. It might surprise many of you, probably most of you, because we're trained to count carbs and take our meds. And well, how is it that you can have two people eat carbs daily, the same amount of carbs, yet one person develops type 2 diabetes while the other doesn't. Well, it seems that carbohydrate intake isn't necessarily correlated to the prevalence of diabetes in any given region in the world. And these world maps illustrated really well. On the right, you see a distribution of basically the amount of carbohydrates that people eat in various countries. And on the left, you can look and see how common diabetes in those countries is. And so when you look at places like, for example, China over here and Russia, very big areas, they eat the same amount of carbohydrates, yet the amount of diabetes, the prevalence of diabetes in China is a lot higher than Russia. And places like this in Africa, right here, very high consumption of carbohydrates. When you look at these countries on the map here, and I'm not exactly sure which one these are right now, you see that there is very little diabetes in those places. So again, it just shows you that the amount of carbohydrates doesn't necessarily correlate to the extent of diabetes. And this is further supported by the fact that the consumption of diabetes, particularly, well, this refers to the US, but consumption patterns are closely similar in the US and Canada. And so in the US, the consumption of carbohydrates actually went down between 1999 and 2016, all while the prevalence of diabetes kept on going up. It's not like there's been a decline in the number of diabetics. And in fact, younger and younger people are now being diagnosed with type 2 diabetes. Let's look at carb basics. What are carbohydrates? Carbohydrates are sources of glucose, basically. That's what they are. So starchy foods, that's what starch looks like in principle. It's a diagram. Basically, this G refers to glucose, and what it is, it's an aggregate of glucose, beads or chains of beads of glucose. And fruit also have a lot of glucose, but half as much, because the other half is fructose. So perhaps might be more suitable for diabetics. And you can test this. You can eat these things. I would eat a particular fruit on more than one day and just test my blood sugar levels 2 hours later. And again, I would do it more than one day just to see if the results are consistent. Yeah. Okay. So what is glucose? Glucose really is a source of energy, source of fuel, just like we need fuel to petroleum, gasoline to fuel our cars so that our cars can function, we can drive them. Glucose is needed for the functioning of our cells. This faint square area here is supposed to represent a cell. This is what this diagram is. Basically, glucose enters the cells and it is broken down through a series of steps to produce energy. And it is represented through this molecule here, this 3-letter acronym ATP. It's a storage, it's like a battery, basically. That's how energy is stored. Now, most of this energy is produced in a compartment in the cell known as the mitochondrion, okay? And in diabetes, these processes inside the mitochondrion aren't very efficient. And also the movement of glucose into the mitochondrion often is compromised. And if we can unlock these issues, then we can help improve, perhaps reverse diabetes altogether. Incidentally, as we get older, there's fewer mitochondria in our cells. So this is a concept I'll get to in a moment on this slide. Basically, what is this energy used for? Well, your cells need energy to function. It's used for our cells to be able to function properly. And of course, in the aggregate in our body, we need energy to live, right? Our bodies are made from 6 trillion cells or so, depending on the size of the person, a little more, a little less. Depending on where the cells are located and where the weakest link is, if energy isn't provided because of inability to uptake and utilize glucose as fuel, then consequent issues will follow. For example, if gastrointestinal cells are affected, then gastrointestinal symptoms will follow: acid reflux, bloating, inability to digest, discomfort. If the immune system cells are affected, then we'll be more prone to colds and flus, and we won't be able to recover as fast. the brain is highly reliant on glucose. And I'll talk about another source of fuel in a moment, but the brain is highly reliant on glucose. And in fact, changes to the brain in the form of memory loss, dementia, and Alzheimer's are known as type 3 diabetes. And other changes can be in the form of changes in mood, reduced patience, proneness to anger, and write out depression and anxiety. Now that energy from glucose also used to repair and regenerate structures in the body. And so if that's lacking, perhaps our bones aren't going to regenerate properly and osteoporosis can set in. And we don't see what happens in our body. Of course, we can't see, but we can see on the outside. And that lack of energy can contribute to hair loss, more so in women, not so in men, not so much in men. It's a factor in men, it's a factor in male pattern baldness, but certainly it's more relevant to women. Now, all in all, as we get older, our capacity to produce energy goes down because of reduction in the number of mitochondria in our cells and the ability of mitochondria to use fuel for energy. And by addressing the underlying causes of diabetes, not only can we improve the condition, perhaps reverse the condition, but also slow down aging and age more healthily. So this is another really, really important concept. And it follows from what I said so far. In type 2 diabetes, the switch that allows glucose to enter the cells malfunctions. And so much of the glucose stays outside the cells in the blood vessels, resulting in high blood sugar levels. Right? So it's not so much how much glucose we're consuming, it's the fact that that switch is malfunctions and the cells cannot receive that glucose and utilize that glucose. And so there are different causes for the malfunction of the cells. So there are several important points, 2 important points, actually 3 points here on the slide. But why they are is that withholding glucose doesn't fix the switch. I think I added later on the second bullet, and I didn't fix the title. Most medications don't fix the switch, and I'll touch on that at the very end. And to fix the switch, you need to find out what caused its malfunction. This is really, really key. Okay, so withholding glucose doesn't fix the switch. To fix it, you need to find out what caused the malfunction to begin with. So what are common causes of the malfunction of type 2 diabetes? Let's explore those. So the first one I want to present is the cells are full of what? Full of electrons. What do electrons have to do with this? Well, when glucose is utilized to produce energy, I'm just going to go back up here. What happens is electrons are being stripped from glucose. So it's a little bit like the concept of electrical energy that is used to power appliances and bulbs, light bulbs, except that in the cell, it's not just electrical energy, it's electrochemical energy, because the energy is stored in molecules and chemical compounds. But basically, oxygen and vitamins and minerals and enzymes are used to strip electrons out of glucose. And so when there is a type of stress known as oxidative and reductive stress, for that matter, and most people are familiar with oxidation, oxidative stress, free radical damage. But for anyone with some more knowledge, deeper knowledge in biochemistry and chemistry, they probably appreciate that there's also something called reductive stress. And basically, it's the accumulation of electrons in the cell. So if the cell is filled up with electrons, then there is no need for more electrons. So they're going to say, no, glucose, we don't need you anymore. And that's basically, that blocks the uptake and utilization of glucose. So what are some common sources of this type of oxidative and reductive stress? So the first thing on the left is something I talk about a lot, and it's the utilization of cooking oils, particularly those that are derived from seeds and grains, canola, sunflower, and so on. Those are very prevalent. People use these to cook at homes. They're available commercially in restaurants through commercially made foods. So limiting those is really, really important, because those are prone to giving away excess electrons and blocking glucose from getting into the cells. What's on the right here basically is supposed to represent iron. And over here you see heavy metals. And basically, these are also culprits of reductive stress, and excess presence of iron and heavy metals can also block the utilization of glucose. I'm going to expand on these points a little bit. And basically what I want to show here is, how do you know that this is happening in your body? Again, we can't see inside what's happening, but on the outside, these brown spots basically consist of what is called as lipofuscin or lipofuscin. Different people pronounce it different ways. Basically, it's a combination of derivatives from these oils known as lipid radicals that interact with iron and metals. That's what it is, basically. It's a combination of those two. And we get more of these brown spots, which are also known as aging spots, as we get older. So again, it just confirms what I shared with you so far. Now, here's an important point. Fatty acids can also be used as fuel for energy, but they require more oxygen. Okay, so they're not as efficient. And some types of tissues and organs still prefer glucose, just like what I mentioned about the brain a moment ago. It will not take fatty acids to produce energy. It will take ketones, and which are derived from fatty acids when someone follows a ketogenic diet. I won't get into that in this presentation. I'm not a huge proponent of that, but the fact is that in general, our body still prefers glucose over fatty acids. Now, fatty acids can come from saturated fats, which you get from cream and butter and meats, and also coconut oil. Fatty acids can come from avocados or olives. So these are saturated fats. These are mostly monounsaturated fats. So those are fairly stable. The problem is really with this here. Okay, so just be mindful of that. As far as iron goes, here, really important and interesting concepts. Women absorb iron at a much higher rate than men because women also lose iron when they menstruate, right? And so they need to be able to absorb it more efficiently, except that in postmenopause, their levels catch up to those in men quickly, all right? And so it's important, again, diabetes more of a disease of older adulthood. So it's important to be mindful of the role of iron in it. And so where do you get iron from? Other than meat, the common source is enriched flour. Okay, so perhaps a good idea to limit or avoid these types of foods. And certainly it is important to test your iron and other molecules that are related to iron, like ferritin, for example. Okay. As far as heavy metals go, although our water and food ought to be tested and free of heavy metals, these are likely the most common sources, right? Nowadays, nobody works with mercury in workshops. Nowadays, there is a lot less exposure to lead through paint, for example, which was lead in paint was a major source of exposure to this particular heavy metal. This doesn't happen much, but unfortunately, heavy metals end up seeping into the water and food supplies. So if you want to find out if that's possible culprit, you need to test to determine the levels. In general, there are different toxins that block glucose and the metabolism of glucose. Drinking too much, so alcohol, smoking too much, again, heavy metals, just a different way of looking at them. Smoke and smog, so particles from cars, from industry, which tend to affect us more so in the fall and winter time when the air is drier because they drop to the ground more readily. Whereas in the winter with humidity, in the summer with humidity, they tend to be present at higher altitudes. Of course, as I mentioned before, the water can contain different types of chemicals that end up in our waterways, without getting into too much into this right now. This is a really important source of toxins, agricultural pesticides, herbicides, fungicides. that end up on our grains and our vegetables, particularly Roundup, also known as glyphosate, which is very disruptive and can contribute to diabetes. And you find it on grains such as wheat and corn and soy and so on. So it's important to be mindful of that. Even some potatoes are sprayed with Roundup. So it's important to be mindful of that. Perhaps choosing organic is a better way to go when trying to reverse diabetes. Now, another cause is lack of resources. What do I mean by that? So lack of vitamins and minerals. And actually, this is an extension of the previous slide, because drinking too much can deplete vitamin B1, for example, and smoking can deplete vitamin E. Both are very important for the utilization of glucose, the uptake of glucose. Heavy metals displace important minerals such as magnesium, potassium, even sodium. Okay, those are really important for the metabolism of glucose. So ensuring adequate supply of nutrients, evaluating whether there is lack of certain nutrients, and ensuring adequate supply is really important for recovery. And another important resource for the metabolism of glucose, of course, is oxygen. And what would limit the presence of oxygen? Of course, certain diseases can, but more commonly just being sedentary, right? Because when we're active, when we're physically active, we breathe more and we take in more oxygen. And it is well known that being physically active can prevent and can improve diabetes, right? So physical activity is really important, and it doesn't have to be anything overly big and structured. Walking every day can be great. Doing yoga and stretches can be fantastic, things that you like. But even just intense short bouts of exercise before and after eating, just for a minute, going on a stationary bike very fast, doing some jumping jacks, doing some light chores before or after eating. Test that and see for yourself if your sugar levels improve or not. Now, stress in general, I talked about oxidative stress, but stress in general can block glucose and utilization of glucose, and particularly the stress hormones, the hormones that are produced in higher numbers as a result of stress. And there are different sources of stress. I don't want to spend too much time on this, but basically just general mental, emotional stressors that weigh a person down, too much work, of course, chronic pain can be a source of stress and result in the production of the stress hormones. And also seasonal stress. So in the wintertime, there's less daylight, and light itself, or lack of light, can result in a rise in cortisol. Typically, people feel more down. There's something called seasonal affective disorder, which is related to wintertime. It's wintertime depression. Why does that happen? Because there is decrease in daylight. And also during the day, cortisol levels decline during the day when there is daylight, and they increase at night when we sleep. And of course, that is likely an important contributing factor to high early morning blood sugar levels. So it is possible to counteract the hormones of stress by enhancing the production of the hormones that promote vitality, because they can help normalize glucose levels. So some examples are progesterone, thyroid hormone, and DHEA. So a couple of notes that I want to share here is that low thyroid hormone, which is not always picked up by standard tests, contributes to type 2 diabetes, and vice versa. Type 2 diabetes can lower thyroid function. So the two are very much connected. And DHEA, another steroid hormone. And so this just reminded me of an example of how addressing hormones can help reverse or normalize blood sugar levels and reverse diabetes. In this particular case, a man came to see me to help him with his BPH, which stands for benign prostatic hyperplasia, just enlargement of the prostate, which affected his urinary frequency and comfort, lack of voiding. And so we treated that with several things, including DHEA. And shortly after we implemented this, he reported that his blood sugar levels normalized. And that's not why he came to see me to begin with. So very interesting case. Another cause of high sugar levels is liver stress, so to speak. And I chose this image here, even though it's not totally accurate, but it allows me to speak about relevant things. So here it shows you that high-fat diet can cause stress and cause gluconeogenesis, which basically means the production of glucose from what? From protein and to some extent fatty acids, but mostly from protein, which isn't a good thing because that can cause your muscles to waste, reduction in muscle mass, which isn't a good thing at all. And so as a result of that, there is increase in blood sugar levels. High-fat diet, most of the people that I work with don't really follow a high-fat diet, but it's just the natural state of diabetes. There's an increase in the presence of fatty acids. Fatty acids are released constantly as fuel because cells aren't able to utilize glucose efficiently. They have no choice, but have to rely on fatty acids. And so indeed, there is this manufactured state of not so much because of a high-fat diet, but because of the mobilization of fatty acids from cells, from fat stores, that is, to the cells to be used as a source of energy. And so it's really, really important to support liver health to help reverse diabetes. And there are different strategies, and really it comes down to, again, what causes the liver issue to begin with. So yes, free fatty acids can do that, and it's valuable to test free fatty acids, but there can be other causes as well. Now, this is a really important cause of diabetes that is not very well known, and I'll explain why in a moment. But this is basically about toxins from within, toxins coming from within. These are known as endotoxin. They come from certain types of bacteria. And one source of endotoxin is actually respiratory bacteria that end up causing respiratory infections. And indeed, sometimes people develop diabetes, either type 1 or type 2, after prolonged, difficult respiratory infections. But more commonly, these come from the gut, where there is a lot of bacteria in our intestines, right? And so this image here is supposed to depict sort of side view of a cross section of the intestinal wall, where this is the space through which food comes, and it's supposed to go in through the mucus area here into the cells and then into the blood. This is supposed to be a blood vessel here, and the space between the cells is supposed to be sealed. But under stress, you can see the legend. This bolt here represents stress. This represents LPS, which stands for lipopolysaccharides, also known as endotoxin, gut bacteria, and toxins underneath, okay? And so other conditions of stress, different sources of stress, the space between the cells opens up that allows for the influx of bacteria and its byproducts, which are known as LPS, or a simpler term is endotoxin. And so this is a major cause of different types of inflammatory conditions, from arthritis to benign prostatic hyperplasia. It contributes to poor metabolism, to lung issues, to all kinds of things, including diabetes, major cause. Okay, so well, you don't hear much about it, likely because there aren't common tests to detect the endotoxin. Specialized tests are required, okay? And clinicians initially rely on recording signs and symptoms. So things that I just described right now, different diseases, inflammatory diseases, or just signs that are related to poor gastrointestinal function, again, acid reflux, digestive discomfort, and so on. Now, indeed, there are various substances and methods that can help decrease or counteract the effect of endotoxin. Substances are both natural and even low-dose antibiotics. Certain antibiotics can be very, very helpful in this regard, low dose of those antibiotics. So again, it all comes down to digging deeper and finding out what might cause the issue and how it's presented. Another common cause, which I have spoken about before and shared information about before, is medications. And so this table here lists a variety of medications that can contribute to increased sugar levels in diabetes. Some of them are not very common. Some of them may be relevant to you, others may not. But certainly the ones that I see most commonly are the high blood pressure medications. Here it lists thiazide and loop diuretics, the water pills, but it doesn't list, and erroneously so, beta blockers like metoprolol, atenolol, bisoprolol, which are often used to manage blood pressure and other heart issues. Those can also lead to diabetes. Another common type of drugs are the anti-inflammatories, corticosteroids, and cholesterol-lowering medications, which are very commonly used, very commonly prescribed, right? Also oral contraception, but also not just contraceptives, but hormone replacement therapy type of medications. Estrogen, and not so much progesterone, it's estrogen really that contributes to higher blood sugar levels. Synthetic progesterone can, but not natural progesterone. So it is possible to employ the concept of treat the cause utilizing natural strategies to replace the need for medication for most of these conditions, right? That's what I often do with my cardiovascular clients. And this alone can be a significant step in resolving type 2 diabetes. So I basically finished this section on the most common causes of diabetes. And now I briefly want to talk about medications. The fact that drugs don't fix the cause of the malfunction, right? It's the various malfunctions. And I went over different types of malfunctions, different causes for diabetes. And drugs typically don't address the cause, right? So I'm going to use just one example. The most common medication for diabetes is metformin. And I like encouraging clients, people in general, I inform them of this tool. This is a very important tool, a valuable tool, PDR, Prescriber's Digital Reference. You can go online, can type the name of your drug and find out the drug summary and look through it. Understand, how does the drug work and what are some of the potential issues that it can cause. So metformin specifically works by reducing the liver's production of glucose and reducing the amount of glucose absorbed by the intestines. So what does it do? It blocks the availability of glucose. Blocking the fuel itself isn't necessarily going to solve the problem, right? Now, helping the liver produce less glucose might be okay temporarily, but there is a reason why the liver is able to produce additional glucose. When we sleep at night and cortisol levels rise and we don't eat, perhaps it's a good time to have a little bit more glucose in the system, right? And so again, it doesn't address the cause. And when it comes to this type of drug, you must watch out for lactic acid production. Best tested, you can test lactic acid, but best tested by LDH, or lactic acid dehydrogenase. That's what it stands for, as it is a good prognostic marker to determine in which direction the disease is headed. And I'm using the word disease here for a reason, because it's not just relevant to diabetes, it's relevant to cancer and it's relevant to overall aging. Okay, so this is a very useful test. And overall, prolonged utilization of metformin can cause increase in lactic acid, which means lactic acid is produced from what? From glucose, when glucose isn't able to get into the cells to do what it's supposed to do. So it's just a sign that things are getting worse. Okay, so I'm nearing the end of the presentation, and so far in this presentation, I learned that carbohydrate consumption doesn't cause diabetes. Very important point. You learned the various common causes of diabetes and a number of tips that you can implement right away, right? We talked about different things to look out for, to avoid, to do, to test. And you learned that most medications don't treat the cause of diabetes and can contribute to unwanted health consequences. In fact, I didn't go over this in a lot of detail, but if you're going to go into this resource, you'll see a list of potential side effects. So I talked about just a couple things here, but yes, medications typically don't come without side effects. And sometimes they come on more quickly, sometimes it takes longer, sometimes the intensity is low, sometimes the intensity is high. Now, once you find out and address the causes of diabetes in your specific case, you could control your numbers better without needing to go low carb, without needing more medications, and increase energy levels and improve your overall health, right? So there are different things. Again, I mentioned different things that people experience along with diabetes. Maybe they're not sleeping very well. There can be all kinds of gastrointestinal issues, aches and pains, and things like that. So all these things, the right approach can lessen or resolve altogether. The problem that many diabetics face is that most doctors don't focus on the cause of diabetes. They just ask you to watch your carbs and take medications. Right? So you're not dealing with the cause. Therefore, the disease state may get worse over time. But as time goes by, many diabetics need more and more medications to try to control sugar levels. And at the same time, how much stricter can your diet get? You can't just stop eating, right? And also, without proper treatment, you run the risk of experiencing unwanted complications. And you might be familiar with the complications of diabetes, which include cardiovascular disease, stroke. The decrease in circulation to different organs can affect your eyes, poor vision can affect your kidneys and contribute to kidney failure, and can also affect the nerves, causing nerve damage, burning and tingling in the feet and the hands as an example. And of course, the loss of sensation altogether. That is something that we want to avoid. So to make significant changes to your sugar control and A1C without hard to follow diets, it is important to dial in on the causes of your condition and then deal with these causes with proper individualized guidance. Treating just the symptoms eventually stops working. And this is what I do in my naturopathic practice, and this is what I can do with you. With my individualized diabetes turnaround method, you don't need to starve yourself or avoid carbs altogether, because I help you restore your cell's ability to utilize glucose as a source of energy once again. And so how do I work? How does this work? What am I proposing here, if you like? Well, this starts with a 15-minute diabetes turnaround assessment, where we dive into where you're at right now by gathering pertinent health information, perhaps lab tests and things like that. And I put together a strategic plan for you based on your situation. It's customized, it's individualized. The session will allow you to gain a deeper understanding as to what steps you need to take to improve your numbers and help even reverse diabetes altogether. Okay, so that's possible as well. Certainly have done that before. Everybody's different, but it is possible. The diabetes turnaround process is designed to improve your sugar numbers without restrictive diets, stop piling on more medications, and likely get you to a point of needing less medications and maybe no medications, right? It's not uncommon that can help people get off their medications altogether. And also it's designed to improve other aspects of your health, as I mentioned, that may need help, like increase your energy levels, help you sleep better, support cognitive and mental health, and other issues that you may be dealing with. And you'll end up avoiding the unwanted complications of type 2 diabetes. I design and help you carry out a personalized action plan suited specifically for you and your needs to achieve your health goals. And it typically consists of specific tests to monitor certain markers and the progression of your health, personalized dietary guidelines, customized plan of using natural medicines, and other relevant recommendations, depending on the presentation, depending on the person, what's needed for you. So to take control of your diabetes and set up a complimentary diabetes turnaround session, send me an email and we'll book a consultation, a brief consultation. We'll dive deeper into, I'll have to collect some information, as I mentioned, we'll dive deeper and we'll put together a plan for you. And that's where you can also find my diabetes page. So you should have my email and can also contact me through that website, that webpage. And hopefully sooner rather than later, just like Marianne, you'd be able to say, oh, by the way, I'm not diabetic anymore. Okay, I hope you found this presentation helpful, and I hope to be able to assist you in person. Take care.